Hi there. Have you ever wondered how drugs produce their effect in the brain? Or why do we use one drug in one species and a different drug in another? I'm Dr. Larson, and we'll be reviewing some of the ways that drugs used in veterinary medicine produce their sedative, anesthetic, and analgesic effects, and some of their special uses. In addition, you'll learn about their side effects and interaction with other compounds in preparation for anesthesiology, where you'll use these drugs in specific combinations tailored for each patient. The magnitude of CNS depression produced by these compounds is dependent on the specific drug and the dose administered. The following comparisons should clarify the terminology I'll be using. Sedation refers to the depression where the animal is awake but not active and not easily aroused. Hypnosis reflects a deeper level of depression and indicates that the animal is asleep and can't be roused from sleep unless subjected to pain. In that event, the animal will perceive the pain and will respond. It's not until the animal reaches a level of anesthesia that they're unresponsive to painful stimuli. Even then, while not conscious or exhibiting motor responses, the animal's brain still perceives change in afferent or sensory input along pain fibers, and this activity is evident in the form of sensitization to pain well after the termination of the anesthetic action. For these reasons, it's important to remember that sedatives and anesthetics should never be used for surgical manipulations or any other painful procedure without also ensuring that the drugs used have analgesic activity or that additional analgesic drugs are administered together with the anesthetic. Analgesia simply means an inhibition of painful sensations and reflexes. It's important to understand that the brain normally has a balance between inhibitory and excitatory activity that's appropriate to keep an animal awake or asleep, or even allow them to respond to specific stimuli. This balance results from inhibitory neurotransmitters that induce hyperpolarization of nerves and excitatory neurotransmitters that produce depolarization of nerves. Most neurons in the brain are not active at any one time. If they were, we'd feel the clothes on our skin and think about our grandmother and hear every noise in the room all at the same time and with the same intensity. When taken to the extreme, activation of all nerves in the brain would lead to convulsions. Instead, there's a dominant inhibitory tone that keeps the brain relatively inactive. It's actually a myth that if you could use more of your brain, you would have a higher IQ or be able to think better or more clearly. In fact, if you increase the number of nerves firing at any one time, you'd be unable to coordinate your muscles or focus on any one thing and probably be having seizures. The solution is that the brain keeps most of its neurons quiet by maintaining an inhibitory tone. This allows you to move your muscles in a coordinated fashion, focus on something, and be conscious of only a few sensory inputs at one time. This all impacts on how you can produce sedation and what side effects any particular drug might have. The basic strategy is to produce sedation by either enhancing the dominant inhibitory tone in particular parts of the brain, or to inhibit pathways that mediate excitatory activity. First, we'll look at an example of sedation caused by blocking excitatory actions in the brain. As you know from physiology, sodium channels support depolarization of neurons by allowing sodium ions to suddenly flow across the membrane, leading to an action potential. Local anesthetics are compounds that block sodium channels, and by this action, block the generation of action potentials. And this is the basis for their local anesthetic effect, which is often used clinically for joint blocks and laceration repairs. However, these drugs can also diffuse away from their site of injection and distribute to the brain, where they can produce either sedation or convulsions. The effect depends on both the compound and the dose that was administered. So why, you might ask, can local anesthetics that block excitatory activity end up causing convulsions? The answer to this is that their effect on sodium channels is not very selective, because all neurons, whether they're excitatory or inhibitory, have sodium channels. So they indiscriminately inhibit both excitatory neurons as well as the dominant inhibitory neurons in the brain. So depending on the dose and the drug, they can either induce excitation or depression, and may even produce both at different times after a single injection. Another important approach to producing sedation is by blocking the action of specific excitatory neurotransmitters like noradrenaline, also known as norepinephrine. Noradrenergic nerves project to a variety of places throughout the brain, including the reticular activating system, located under the cerebellum in the lower brain. This nucleus is an important center that maintains wakefulness. When you inhibit the binding of norepinephrine to its receptors in that area, then sedation results. For example, major tranquilizers are drugs that act as specific pharmacologic antagonists at alpha-1 noradrenergic receptors, thereby inhibiting the reticular activating system. These receptors are located postsynaptically, where they normally increase reticular activity. Another important group of compounds that inhibit noradrenergic activity in this area are xylazine derivatives. These compounds act slightly different in that they enhance the feedback inhibition of noradrenergic neurons. They do this basically by fooling the brain into thinking there's too much noradrenergic neurotransmission at any one time. This effect is brought about by their selective interaction as agonists with presynaptically located alpha-2 adrenergic receptors, sites that decrease the release of the endogenous norepinephrine. Another way to induce sedation is by inhibiting the action of excitatory amino acids like glutamate and aspartate. These amino acids are not only building blocks of proteins like all the other amino acids, but they also serve as neurotransmitters in the brain. Glutamate and aspartate are widely distributed throughout the brain and interact with a variety of receptors, all of which induce depolarization. Ketamine is a compound that inhibits these receptors, specifically the N-methyl-D-aspartate or NMDA receptors. As a result, ketamine causes sedation at low doses and anesthesia at higher doses. In contrast to the compounds that inhibit excitatory activity that we've just talked about, you can also produce sedation by enhancing inhibitory transmission. The most common approach is the activation of gamma-aminobutyric acid or GABA receptors. GABA receptors are located on large chloride channels that are made up of many subunits. When GABA is released, the chloride channel opens, allowing the negatively charged chloride ion to flow through, causing hyperpolarization and hence inhibition of the neuron on which the receptor is located. The activity of GABA-mediated chloride channels is normally modulated at a variety of sites that are sensitive to different drugs. For example, minor tranquilizers are compounds that potentiate the frequency of GABA channel opening. Barbiturates are another category of drug that potentiate GABA activity. However, instead of increasing their opening frequency, they enhance the duration of channel opening. This allows a large amount of chloride to flow through the channel. As a result, barbiturates have an even greater inhibitory effect than that produced by minor tranquilizers. For this reason, barbiturates are potentially anesthetics at high doses and sedatives at lower doses. In contrast, minor tranquilizers only produce sedation or hypnosis and are unsafe to use as anesthetics. Other compounds that induce GABAergic activity include alcohols and muscle relaxants, drugs that produce sedation, and inhalant anesthetics, propofol and etomidate, drugs that produce anesthesia. In the lectures to follow, we'll present material about specific drugs that influence the brain to produce sedative, anesthetic, and analgesic effects that you'll need in veterinary medicine.